delivered, because it's very important about the consumer that's utilizing the technology.
And do you find any resistance from consumers that who might feel that this is too intrusive, that this is sort of Big Brother-like?
It's interesting. I would have a different answer to that question 10 years ago. No question, time has created a different environment for us around privacy, fear around using technology, and we're at a very exciting time where, which is why we felt the time was right to come to a show like this and expose ourselves now in more of a consumer type of scenarios, because people are looking for these things not because they're worried about Big Brother, but more that they're interested in peace of mind and assistance. People are looking for support and better participation, how they can better maintain their own lifestyle, educate themselves around their chronic condition, and more importantly, alleviating the burden around caregivers and what they have to deal with.
So you're finding much less resistance to the idea?
No question, no question.
Okay. You know, and we can see that based on the number of people in the audience that there's a great interest in this subject. And what we can also see as we walk around the floor is that most of the companies involved are small companies. The big companies, except with a few exceptions, have not yet got into this space. And I think it could, you know, it's obvious why. It's a new business. Small companies can maneuver much quicker, and they can turn on a dime, whereas large corporations often can't. eCardio is one of those companies that began with one individual, and in just a few years now has several hundred, I believe, employees. And they specialize in making heart monitoring, arrhythmia monitoring products. And Andrew Arroyo is the Vice President of Information Technology for eCardio. He directs eCardio's strategic technology planning for information systems and business applications. Andrew?
All right, you've heard about the consumer side. Now we're going to talk a little bit on the professional side. The doctor-driven, medically specified cardiac arrhythmia monitoring. To Jill's dad, thank you for coming. Hopefully I don't know if we were the right company that did your service, but on behalf of the industry, thank you for being here. One of the big things we have is this cardiac monitoring has been around for a long period of time. The continuum has shifted very significantly from the doctor's office being the only place where the heart can be looked at to now being anywhere in the world and your heart can be monitored. It's still, right now, very much a prescription-based system. The patient goes into the doctor's office, doctor doesn't catch anything on the 60-second scan, which isn't unlikely. The patient goes home with a monitor, or the doctor sends the prescription to us and we send the device to the monitor. We work with the patient to educate them on why the monitor is necessary, what information we're looking for, what information the doctor's looking for, and why it's so important that they're a participant in this care. And then we wrap it up with providing back to the doctor only the most relevant and valuable data that they need to look at. The doctor doesn't have time to sit and look at 100 reports a day from one patient to understand that the patient hasn't experienced anything significant. We can wrap that up into one report and say your patient has been monitored, your patient is compliant, but the patient hasn't experienced anything that needs urgent care. Why is it valuable? For patients, we get a lot of information, but it extends from a 60-second to up to 30 days. So the patient's constantly monitoring. They get peace of mind knowing that somebody's watching. Somebody's always there to take their call. Even when their doctor's office is closed, we're open. For the physician, it's getting the most relevant information at the best period in time, with us also watching to notice and act on their behalf. So we become an extension of the doctor's office rather than in competition with the doctor's office. And for the insurance companies and the healthcare system in general, our goal is to try to drive the best diagnosis with the least amount of time, the least amount of cost driven back into the system, and to get the right solution for that patient, whether it's a drug or a device, or ultimately it couldn't even be a surgery. Understanding that the continuum has shifted, you start back in the 1960s with Holter monitors, and the technology then was very bulky, it was very large, it was on cassette-based tapes. Patients wore backpacks, literally, to record this data. It goes back into a doctor's office, and a nurse sat and spent 30 minutes to 2 hours analyzing that information for the patient. You move forward in time, we get to event monitors, which is a great leap forward because it was constantly watching that patient and only escalating those events that needed to be looked at. Or when the patient felt a symptom, they can hit the button and that information gets tracked and sent along to the doctor. Now we move into the 80s, 90s, and beyond, and you start getting into wireless monitoring, you get into cellular-based monitoring. Smartphones have had a significant impact in what's currently going on. If you look at some of our competitors, you will see smartphones, you'll see Bluetooth. Some are using straight RF signals rather than going Bluetooth just to get the distance. But a lot of that is still doctor-driven. One thing we haven't gone to as a healthcare system is where we wrap it back around to the full continuum, which includes the consumer or the patient. The patient ultimately is going to be the one that drives their own care. Our marketplace, it's small and getting smaller. As the companies get bigger, the doctor's offices stop doing the service. As Dr. Grasso pointed out, the revenue slide is continuing. The cost slide is going upward. So the only ones that can participate in this, we have to bring scale. And only through scale can we bring enough cost out of the system to still be able to provide the critical information without it crippling. Our sales approach has been all about informatics. We joke at times that we're a technology company that happens to do cardiac monitoring. There's pieces of it that are critical. Getting the right information to the patient, getting the right information to the doctor, ensuring that the wrong information doesn't go to either party is a huge undertaking and one that we don't enter into lightly. I want to wrap up with looking at some of the innovations that are currently happening and going on. As I mentioned, smartphones is a huge thing. One of the things you've probably seen, there's some different viral videos going around about smartphone-based ECG systems. You have companies like Ideal Life, you have companies like Zephyr that are bringing the consumer into the medical continuum. And where we want to position eCardio is as that interface point between the consumer and the professional and being able to translate those patients through the system bidirectionally. So if they start with Ideal Life and they come to a point where they need more specific care, then we're here to provide it for them. If they start with us and they don't find anything that the doctor needs to work on, then we transition them into the continuum of the consumer care. And that's really where we're going to be is that blending of professional and consumer is really the future of where all of our industry is going. Thank you.
Thank you. Well, we have a great panel, and regrettably, we don't have a lot of time to ask questions, but let's get to it. I'm sure a lot of people have questions. We only have a few minutes. Are we passing mics out?
Yeah, quick question, Shekhar.